Fund is here. Yafika. Muuni Fund is here. Yafika. Kuthandiza Malawi tipeze njira zotana ndi mavuto kuza dziko lathu. Muuni Fund is here. Yafika. Muuni Fund is here. Yafika. Kuthandiza Malawi tipeze njira zotana ndi mavuto omwe amagwa mdziko lathu.
Congratulations for making it to the regionals, and congratulations for bringing a solution.
Thank you very much.
Please introduce yourself and which council you're bringing your solution to.
My name is Mike Chapuma, and I am here for Palombe District Council Innovation. Basically, it's a website and also a hosting solution.
Oh, okay.
Yeah.
So before we get to the innovation, the solution, tell us a little bit about yourself. Do you actually come from Palombe, or this is just the place that has been blessed to have a solution from you?
No, that's interesting. I actually come from Zomba, but when I saw the applications, the call for applications, that is, the Palombe innovation that took interest. I took interest in the Palombe innovation. So that's why I decided to apply for that.
So what do you do?
I'm actually working with the Zomba District Council in the finance sector.
Oh, look at you. Okay, yep. Finance in Zomba. Now talking about Palombe, what is the challenge that was brought to the table? What's the innovation in some good terms?
Well, so as I already mentioned, it's a website for the district council. So basically, I even though I'm in finance.
Yes, I was about to ask how the finance guy ended up working on a website.
Yes, but I do a little bit of programming as well.
Okay.
Yeah, but a combination of both. There was a time that I was struggling to find information for councils when I was doing a little bit of research. So when I saw the call for innovations, when I saw Palombe District Council calling for a website, I was like, okay, this is an opportunity for me to offer a solution for what I was struggling with, basically.
That is awesome.
Yeah.
Well, I wish you well as you present your innovation.
Thank you very much.
Good luck.
Yeah, thank you. Thank you very much for giving me this opportunity. As already indicated, my name is Mike Chapuma. My innovation is Palombe District Council website development and hosting. So I'll just present the prototype of Palombe District Council website. I'll just combine it with the general presentation. But yes, I'll start with presenting the Palombe District Council website prototype. So what we have here is the homepage of the district. So I'll just take you through some of the features because when I saw the list of the available innovations, that was one of the things that I was interested in because part of my work, I do a little bit of research. So I struggled trying to get information for some of the district councils. So when I saw Palombe District Council needing a website, I was like, okay, that's an opportunity to come up with a solution. I have a background in economics, but I told myself web development, so it was part of my passion to take on this challenge. So this is the homepage. As you can see on top here, we have the footer, Palombe DC has some of links to some of the main features. But here we have a hero, just a welcoming message of the district. One of the things that motivated me was, when I was looking at some of the websites, they're just static. You just go there, you get information, But my motivation for coming up with this website was to come up with something a little bit more modern and also dynamic, something that can encourage users to interact with the website, but of course the district. So going further, that's just the welcoming part. It has a section there that will be indicating the current time in Palombe, and also a little bit about the weather there. I was actually interacting with the people in Palombe. I think the systems analyst or the Muuni desk officer. They were actually interested in me adding a proper page that will be indicating weather, because Palombe District Council, as we all know, is a disaster-prone area. So information about the weather will further be added, but this will just show an overview of what the weather is there in Palombe. Going further down, it provides links to some of the things that are there. It will take you to the About Us page, just explaining what Palombe is doing, services, projects, what are the projects that are going on in Palombe. So for example, if we go to services, you see that it takes you to some of the services that are offered at the district. You know, for example, if you want to register your national ID, so that's part of the innovation, to integrate with other already existing systems. By the end of the day, the goal is to enhance service delivery. You know, the goal is to integrate with, for example, the NRB database, so that, you know, people don't have to travel all the way just to check status of their ID applications, or let alone they can be able to access forms to apply for a new ID, or even other things like business license forms, or even land registration. But yes, as I've already explained, you can also check your status for your ID. This will be made possible by integrating with the already existing systems. So this also provides other services like business license forms. You know, some of the services offered at the DCs are getting your certificates stamped, things like those. So all those services will be displayed there on the website. As a matter of fact, there will also be sections where users can, you know, interact directly with the district through the support feature, but also they can get some of their questions answered through the feature for frequently asked questions. So one of the goals as well is to ensure that there is transparency and the district is able to get feedback from its citizens. So I added this feature here on the corner, feedback, where a user can actually rate the how they have experienced the website. So overall, how satisfied are you with your recent experience on Palombe DC website? So they will be able to rate. You know, they can provide general feedback. They'll choose what the feedback is all about, and then they can submit. So I see that my time is running out, so I'll quickly go to projects, which is another interesting feature as well. This is just a page which will indicate all the projects that are happening at the district. And again, the goal is to enhance transparency. You know, what is the funding for the project? Who are the funders? You know, what sector is it? Is it completed or not? Status. It will also show location, where, TA, ward, what. A brief description of the project. So again, to promote transparency and feedback from the citizens, users can also provide feedback. They can add feedback here. Yes, so they can put their email name and comment on the website. So I'll also quickly go to statistics. You know, the website will also display statistics for the district across various sectors. It could be demographics, health, education, agriculture. As I was interacting with the people there, they actually asked specifically for statistics for Ntugulaba Koma, which is under social welfare. So all those things will be added here in the statistics page. But this is just an overview of the statistics. What are the recent trends, population? This is just a map for Palombe district. Yeah, so going further down, it just displays some of the things that are happening in Palombe. I actually got some of these pictures from their socioeconomic profile, which I asked from the district. So these are some of the projects that were indicated, environmental activities, the agriculture part, sustainable fuel resources. So it will just display some of the highlights of what the district is doing. And this is just a summary of the district. So remember, I kept mentioning feedback. Some of the feedback will be displayed in the homepage. So for example, someone commented on a certain project, it will be displayed here on the homepage. So this in Zika said something to do with a certain project or commented on something, it will be displayed here on the homepage. But also it will also display some of the things that are happening in the district, like upcoming events, like training opportunities. For example, maybe there's an International Day of an African Child at the district that will be displayed in the homepage to ensure that citizens are well aware of what is happening in the district. It also just display a list of some of the partners, because the district is not implementing projects alone, so that will be shown there. And then we have recent publications, recent news, what's happening in the district. People can get first-hand information of what is happening in the district here on the homepage. So it would be like that. For example, something to do with the president opening the district council, that will be found on the homepage. But yes, of course, citizens can also stay connected to the district, and they can do that by submitting some of the information. So whenever the website is updated, they can get first-hand information immediately. So basically, that's that's what the website is about. It shows the district map. It has useful links, for example, National Statistics Office, Malawi Ministry of Local Government, some of the closely related institutions. They can also get them there, and then we have contact details. So basically, that's Palombe District Council website. Thank you very much.
Thank you. Right. We know Palombe District Council more. Right. The panelists definitely they have questions.
Yeah.
So I'll start with from my right or left?
Okay.
Left.
Thank you, Chair. So when I looked at your provision for statistics, automatically what comes to the mind is that there's a data system behind those statistics. Because statistics is not just about the displays. So maybe you could share with us what are your plans, or describe to us the data system that is behind those statistics.
Okay.
Particularly, what are your mechanisms of security, privacy, and protection of the data that will be used?
Okay. Thank you very much. I can answer.
Yeah.
Yes.
Okay. Yeah, thank you very much. So part of that, I deliberately added a link to the National Statistics page, because most likely that's where some of the data will be coming from. But it's developing a website like this will probably integrate it with a well-established database. We can use, for example, SQL and all these other databases that are well established. But I'm glad you have mentioned security when we have today the headline that immigration has lost some of the data, or most of the data, if not all. But yes, the goal is to use well established hosting solutions where we are doing probably cloud backups and automated backups. So this website will be well integrated with existing advanced systems where data is being backed up time and time again. There's also the goal to integrate with other already existing systems. For example, I was talking about NRB. This is personal information. So this, if it is possible, there's no way we can be doing that on our own. We'll have to use that same channel they use, which I believe is a well-established secure environment, and then to ensure that we're following all the protocols to do with data security. Yeah.
Thank you. This is a very interesting area where I wanted to promote information sharing with the public. The government is very, very crucial to think to have access to the information.
Yes.
And through digitalization project, districts are promoting automating some of the manual processes.
Mm-hmm.
After listening to your presentation, I have understanding two areas. There are some data which can be accessed by the public.
Yeah.
There are certain information or data that can only be accessed by city district council. I don't know whether you have come up with a model of legal framework in terms of government data or government information. How the website is going to filter that this particular data is for public access.
Yeah.
This particular data is for this council access. What mechanism have you put in place?
Yes.
To make sure that you have these boundaries
Okay.
of data accessibility.
Okay. Thank you very much. I think that is an important point. To ensure that there's that separation, definitely that's how the system will be set up. For example, we can integrate issues of user registration. So for example, if this is something to do with the district, or the district would like to utilize particular data, the website can be set up in a way that there's an administrator accessing that data through signing up and actually logging in from a segregated system. So this just being a website, but ideally it is a web application. So I do not want to get technical, but from my experience working with programming frameworks, like there's something that I like using, it's called Django. It segregates. So an administrator can have their own channel, and then the general user can have their own channel. So through that segregation from well-established frameworks, users, the system in itself will be able to segregate the channel that a particular user takes. So if you are from the district council and, for example, you'd like to update the website, you'd like to add statistics, then there will be a channel that you will take. But if you are a general user, for example, you would like to just check your details, there will be a channel that you will take. So I'm not sure if I'm answering your questions properly, but yes, the issue of security will definitely not overlook it. We'll be working with, if we're integrating already existing systems, we'll definitely take the route that they have already established to ensure that we're following all protocols. But also by the end of the day, I think having those sensitive systems managed by the proper authorities will also help, rather than just giving the rights to anyone else. I think even now with the already existing, we have Ntandizi, which is a climate smart public works. You know, if you are just entering data, there are some things that you cannot access. You're just there as a data entry clerk. But if you are an administrator, then there are things that will be that you have control over. So we definitely take account in that, but that is constantly in the back of our minds. Thank you very much.
Thank you very much.
Thank you. So Mike Chipuma, I have got 2 minutes. I just want to find out one was if you have had a chance to visit Palombe district. Secondly, are you aware that the Palombe District Council already has a website? And based on the website that is already existing, and of course see that the website is not that interactive, which possibly that might be an improvement there.
Yeah.
But there are other services that you might want to learn from.
Yeah.
From the current or from the existing website.
Okay.
And the thirdly is who will be responsible for updating the website.
Okay.
And I think, I think that's the main. Those are the main three questions.
Okay. Yeah. Thank you very much. On visiting Palombe, I have had the opportunity to visit Palombe in general, but specifically for this task, unfortunately, because of logistic issues, I was not able to visit Palombe. I mean, we had we wrote a budget on the prototype and things like those, but they could only provide money for communication.
Okay.
So that's why I was in constant communication with the systems analyst there. As a matter of fact, most of the information that I have in this website, they're the ones who gave me. I asked for their socioeconomic profile, which is a bird's eye view of what the district is about. But also, as I kept mentioning, that they were giving me suggestions. Can you add this? Can you add this? So I might have not visited, but I did. I was in constant communication with them. On the existing of the website, that I was not aware of. I actually did a little bit of my research, checking the existing websites that I'm not aware of. As a matter of fact, I don't know if it's available on the internet, but I did a search. Most of I did not find it, but also it came as an area of interest because it was listed as one of the areas of innovation. So my assumption was that is the need that is there. So I definitely would love to take a look at the existing website and see how to integrate it, because at the end of the day, it's to work on just improve what is already existing, not just come up with something completely new. Responsibility, this is multi-sectoral information. We have the information sector at the district. They can be updating some of the news that is there, and so by the end of the day, there can be one coordinator, but it is multi-sectoral. All these sectors that we're talking about that are able to provide information relevant to the website, but with the help of the information sector at the district council, can be sure to. Yeah.
Right, thanks. I think time is out.
Yeah.
It's a quite important proposal or project. I think for now, I just wish you all the best.
Thank you very much.
You can do more to improve
Yes.
the website, even when you're looking at on the homepage.
Yes, definitely.
Look at the size of the district, the population, demographics,
Yeah.
age, all that. If you already have that, great.
Yeah.
So all the best.
No, thank you very much. The goal is to get as much feedback as possible. So yeah, thank you very much.
So today, Palombe District Council looking at a website and data sharing, information sharing, access to information, which is so key for people, obviously, in the different communities, for them to be able to know what's happening and to make better decisions, obviously, and also to keep our leaders accountable. This is the space that information gives us that power to do that. What are your thoughts around the presentation that we just had?
Right. I think it is a very important innovation, especially people not having information on what is happening at their district council. Indeed, the access to information that bill for it to be alive, the ATI, it means it will be available on the fingertips. But now it all depends on the willingness of the ones to update the information there, so that the information must be really available.
Yes.
Because sometimes the information that the people may want to access, if it's not there, then the ATI is defeated. But it's quite important. It's important for the citizens there. It's also important for other parties, be it the NGOs, on the projects that they are to undertake. The needs of the district will be known from the website. But what is very key is to make sure that the website is live.
Yeah.
Otherwise, if it is history, then it's very difficult for other stakeholders to take the right decisions and interventions to help or be part and parcel of the development of the district.
Which I guess is probably one of the major issues that I find in Malawi in terms of updating the websites and getting information on there. Are there no laws, if any one of you knows, that actually make it a compulsory thing that the information should be updated? Because the information is there, but most times it goes back to the people to actually go and search for the information, but it's not volunteered on public platforms like that. Any ideas around that?
Yes, not necessarily a law, but the policies are there on the information management, data management, in different public institutions. They have the policies, but maybe it's an issue of enforcement within the institution.
Yeah.
Yeah, in terms of data or information updates. What I've observed is that in the public sector, it's very difficult for people to update information. But when you go to the private sector, yeah, it's very good.
Yes.
Every day you get new information on what is happening around. Maybe because it's a marketing issues for the customers, but for the public, we have to challenge. Yeah, so it's a very big challenge.
Awesome.
Even the systems themselves, apart from the websites, the actual systems, to update the information. It's a story. Something like that. Yeah. So maybe because when I was working with the Minister of Health in my project, one of the issues that maybe people are not interested to update information is the use of that information. So they don't,
That no one's using it? Oh, okay.
So okay, if you update this particular information, who is going to use this information?
Uh-huh.
So within the public institutions, people are not using it in the information to make decisions or to take actions. So maybe people who are responsible to update information, they don't see the value.
So the citizenry is passive, pretty much. Even if the information is there, it seems like we're not really taking advantage of the information and actually taking steps towards making a change because of the information that we get. Okay.
There, I strongly believe that the district council, it doesn't sell their own information, especially whenever, assuming that okay, there's a tender.
Oh yes, yeah.
And people are asking, say, information is on the website. People have interest. Say,
Yes.
Let me check. Now they will see traffic. Be it even jobs. There are vacancies. The vacancies, but I hear this, no, the details go on the website. So which means that now people, they'll be driving the citizenry towards the website.
Yes.
But like the one that I have here for Power District Council, the last update is 27 December 2022. Last update. That's why you see that it's very relevant.
Yes.
But now the thing is, when the information is really up to date, it will be easier for even the officials to drive the citizenry towards the website because it is carrying the most recent information.
Yeah.
But that's where we're looking at human intervention in the access to information.
Awesome. Access to information, such a big topic. I thank you for your responses on that in general. So please go ahead. So far, who has been your favorite innovator? Drop their name in the comments below. Create, innovate, develop. Blantyre District Council is getting a solution today, and of course, that is by you. Please introduce yourself.
Well, my name is Chris Kanyuka.
Chris, thank you so much for applying, first off, for thinking, because obviously Muuni Fund Pitch Program is pushing the idea of thought and innovation. What do you do?
I'm an independent IT consultant.
Oh, look at that. Okay, so you're already in this kind of space.
Absolutely.
How long have you been in IT for?
Since 1978.
Now I have nothing to say. 1978.
Absolutely.
That is a while. My goodness. Okay, so talking about Blantyre District Council, what is the challenge that you were drawn to, and what's the solution that you're bringing to the table with the wealth of knowledge and the years of experience that you have?
Well, what I saw as a gap in the country was the way patients are handled in health centers, and also the way commodities are handled, talking about drugs and every other thing, and how we respond to epidemics like cholera and things like those, and obviously how we store information about patients.
Yes.
Currently, you have a patient with a health passport, for example, and that health passport, once he loses it, then the entire history of that patient is lost.
Yes.
And so that made me see that gap in there. So we're bringing a solution that will manage patients' commodities, and actually even the practitioners themselves, because you want to know if a clinician is actually going to work, for example.
Yeah.
How quickly they're responding to issues, and how you are actually controlling the commodities.
Okay.
So that we would like to eliminate the loss of commodities, would like to eliminate laxiness in the industry. We would also like to promote efficiency.
So before you give me your entire pitch, I'm looking forward to actually sitting in and listening in on the pitch as you're giving it to the evaluators today. Does the site have a name or an app, or what exactly are we working with here? Or is it a systems just for?
It's a system.
Okay.
Yeah.
I thank you.
Thank
We're
you.
blessed to have you around. I can't wait to see what you bring to the table.
Thank you very much.
Good luck.
Have a wonderful day.
Thank you.
Thank you very much, panel. My innovation is Health Center Management Information System, which is a cloud-hosted, web-accessible database platform designed to provide stakeholders a world-class system and information on health management and information relating to patient services, inventory management, and data analytics pertaining to health centers and patients. It will create patient profiles with history that will enable a clinician access information that will enable him to make proper diagnosis and effect correct treatment. Enable follow-up on patients that have missed appointments, and patients are reminded of upcoming appointments. Manage commodity stocks and eliminate pilferage. Automatically issue requisitions on commodity outages, and avail analytics that will enable proactivity and predict disease outbreaks. It will also provide alerts on dread diseases outbreaks to health surveillance assistants, DHOs, zone leaders, and potentially the community. We're saying potentially the community because we can also even register anybody in the community, and we'll send SMSs if there's an alert. Retain patient histories and provide referral information. Eliminate current health passport. The current health passport will go. To provide paperless health center operations. Create seamless communication and data flow between HSAs, health centers, DHOs, and Ministry of Health. Allow executive managers to get a bird's eye view of the health status of the district and make informed decisions. And finally, provide potential for accounting for foreign patients in border districts. So you can even claim from Mozambique how much you have actually spent on their patients. It is a user-friendly portal. Patient does not need a health passport book. Reduced patient waiting times. It has been studied that patients in health centers wait up to 3 hours just to get registered. And that study has also recommended that these things should be digitized. Patient history accessed from any health center or registered user service center, because this is cloud-based. So it doesn't, as long as they have got as long as they're registered, they access it. Automated management of commodities. Commodities in their world means drugs, etc., etc., etc. It will issue alerts, as I said, missed appointments, outbreaks, overprescription. So if a doctor, for example, a clinician is overprescribing, it will produce a report. He will not know, but the boss will get a report that, watch, this guy is overprescribing. So that is probably a wastage issue or pilfering. Monitoring personnel performance, because it retains all the appointments. That means if the appointments are not attended to, you know that the doctor hasn't been sleeping. Again, provide a bird's eye view. Elimination, it will eliminate data input at DHOs. DHOs get all this data on paper issues, and it takes a lot of time and all that kind of thing. So, and all the reports will be available in real time. It is scalable, both laterally, across all DHOs, across any environment. It can also be accessed downwards by health surveillance assistants, and it will also be accessible at the ministry, again, because of the design. And being the database is hosted in a secure data center, which we have already tested, so nothing about hacking and things like that. It is very well protected with also duplication of data so that security issues are addressed. And the relational database design makes it scalable because we can't just keep on adding modules, and then you can even add wards, management, patient management in wards, etc., etc. Sorry, we don't have much time. Interoperability, so it has ability to push data to existing systems. Currently, we only have systems of HIV, one for children, and another one for COVID. Those are the only computerized items in the hospitals. The rest is manual. Okay, so it's very difficult for them to get this data and collect and react. So this will also push and pull data from these ones plus this system. That means the entire spectrum is computerized. Now we have also GPRS connectivity. That's a term in the communications world, which is a secure communication between mobile devices and the database. And if there's no network, it can work offline. And when the network is back, it will automatically update the database. We have a data take-on strategy. In other words, when we get rid of the health passport, means we'll have to take, because the history, patient history, is in the passport book. If a patient loses the passport book, the data history is gone. So we will, when somebody is registering, we'll take away their health passport so that we can actually pull the data into the database and everybody has got a health passport. All the history is up to date. Market demand, we've interacted with potential customers. In other words, we sat down with Blantyre DHO through meeting and questionnaire, and I confirmed that the current systems do not satisfy their requirements. Excited about the proposed solution, they confirmed that this product is the solution they require. Studies confirm that the digitalization of health centers operations is required, and there's that link there which you can use to actually find that information. Okay, commercial viability, huge customer base. Blantyre DHO alone handles 2 million patients annually, patient visits, not actual patients, but patient visits. They've got the 9 health centers. Nationally, you have 17 million customer visits as of 2019, and about 476 health centers. To develop this require an investment not exceeding 150,000 USD, and to generate revenue through subscription, which is about 16 cents per patient, which is pretty cheap, and that's what the DHO, every health center will subscribe, which will be derived from the savings, because a lot is lost through pilferage, stationery, and all that kind of thing, which could come back to actually subscribe to the system. If all health centers subscribe in Malawi, we break even at about 100 health centers, and the return on investment within 12 months. Projected cash flow over 12 months is $305,000. So you can see that within 12 months, that return. And obviously, there's no competition. There's nothing like this product. How am I doing on time? So now, because of time, I'll just quickly run you through the prototype. Okay. See, we have, when a patient comes to the hospital, you go to the reception. The reception, first, if he's not in the system, will register. They register the patient and they'll create an ID. And either he uses a national ID, that's what we would recommend, or any other valid ID. And that ID, because we know they're babies and under 16s, so in a family, that ID can carry several members of a family. That's what we need that for. And then when you register the patient, you see you have the ID number, which is the national ID. You get his name. You select his district. You enter his district. You enter the date of birth, his contact, his or her sex, and then there's something which we didn't finalize there. You enter his pre-existing conditions. Okay, that's when you're registering the patient. Now, when you've registered the patient, he now needs to see the doctor. Okay, so you check in the patient. Sorry. Oh, okay. Thank you. Sorry, I was complaining that the time was a bit short, but the prototype is there, and I could have shown you a lot more.
I think it will come through. I think when maybe the panelists got questions,
Yes,
and they may demonstrate in the course. Should there be anything that has to relate to the profile?
fantastic.
Otherwise, thank you so much for this proposed solution to our health centers, where they will have a management information system, and we believe that it's going to be very beneficial, especially on the management of cases that we always encounter every day. So I'll ask my colleague to the right to ask some questions.
Yes, thank you very much, Mr. Kanyuka. It's very important that we need to make sure that our patient data is available across the health facilities. We know the human being is a mobile.
Yes.
So if the person is registered in one health center, definitely tomorrow will be available in another health center.
Absolutely.
So this particular platform can help to share such type of information. My area of concern is now infrastructure in our country. Since the system will be running on cloud, it means that our health facilities must have connection with the internet to access such type of information. So from the current situation that we are now, we are in today, how feasible this application can be scaled up to almost all the health centers?
Okay, that's a very good question, sir. Simply because the internet we're using is mobile internet. I'm sure every clinician at a health center has a mobile phone. That's the kind of internet connectivity that we're using, because they'll have a tablet. They will not have routers and things like that. That's why I talked about GPRS. That's a light communication solution that cell phones use. So, and also remember that I said that the devices which are tablets should be able to work offline. So they can work in the hospital offline, right? And then at the end of the day, when they can go to town, and they want to switch on the the device, it will upload everything to the database. Once they find it, so that's not a problem at all. Because what we do before we implement at a health center in the remotest place, we will actually go there and check the kind of solutions or communications they do have. So we will ensure that there is adequate communication. I remember in my experience with point of sale devices, mobile point of sale devices. What we did, and that time we only had 2G in this country. So what we did was we put a booster on the mobile device so that it can pick signals from the next tower. If this tower is useless, it will pick signals. So we actually go to that area and actually check the signal power. Okay? And secondly, the tablets that we're going to have, we're going to have 2 SIMs at least. So if Airtel is sick, TNM will pick up. So it will do some sort of load balancing at that level and pick the best signal. Yeah. So in Malawi, it's not 100% deployable, because I'm sure today clinician wouldn't work at a health center where there's no network. Yeah. So I don't think that's a word. Thank you, sir.
Thank you.
Yeah, thank you, Chair. I'm only concerned with the scope of your system. Thank you. Made really bold claims there. To predict outbreak. That's a comprehensive system on its own. It will produce real-time data analytics. Another serious claim of how a comprehensive system is like.
Okay.
But more controversial one is you're saying it will eliminate data input. I don't know how.
Data?
Input. I think somewhere you said it will eliminate data input.
No, I didn't see that.
If you scroll.
That's the manual data input.
Oh, okay, all right.
So,
Yeah.
I was interested.
Yes,
in
yes,
that
yes.
stage of
It
how do you plan to capture data? Because you will need to capture data. Yeah, so
Okay, what I meant by that was that what happens today is that they have all these forms to fill, and they're transported on a monthly basis to the DHO. That's when they actually enter them into the what. So you have paper being transported once a month to the DHO, and then they put input into that particular system. So we'll eliminate that kind of process, because once it's captured at the health center, then the data is already available. Therefore, they don't have to actually re-input at the DHO. That's what I meant. Yes.
So maybe just elaborate a little bit about your mechanism for predictive capabilities of your system.
Okay. What we have is there is a diagnosis. Every diagnosis has got a code, and these are codes that are available from the ministry. So what we are, so it has a code and a disease. Okay. Then they say, all right, this disease, if it occurs, is it likely to become a pandemic? So what happens is that we will encode that. We will just put a signal. Say, is this a dread disease? Once that patient has been diagnosed at that health center, what it will do it will send an SMS, number one, to the health center, to the health surveillance assistant, to the DHO, that somebody in Chinyonga A or Chinyonga B, his name is this and his number is this, has been diagnosed with COVID. So that way, we are predicting that kind of outbreak, because that's a seriously, quickly transmittable disease. That's what it is. The first one, sorry?
No, that was the first.
Okay.
Because I was interested in the dynamics of patients as well, the mobility of patients and all. I think COVID taught us a lot of.
Yes.
Revealed a lot of those challenges.
Absolutely.
Yeah.
So
if your system can capture that, I
yes,
think it will be a good improvement.
That's what it will do. Say you have cholera now and all this or scabies. As long as they indicate in the diagnosis table that when this kind of disease happens, You just tick yes or no. So they put yes, yes, yes. Anytime that happens, let's bells start ringing. Yeah, that's what will happen.
Thank you, Chair.
Thank you so much, Mr. Kenyuka, for the responses. With my 1 minute, I just want to find out one on the allies to local leaders, like the village chairman.
Yes.
How is the capturing of the information to that's to cover even a full to
Yes.
advise? There is this at work because you're saying that this information can go
Yes.
as far as that law.
Yeah.
How are you capturing that information? And secondly, the take on the take on process of where you're converting the physical health book to electronic one. I think that is a big process. I'm not sure how quickly things that can be done. And yeah, I think on the registration, I saw some information missing, like blood group, like that, which might be used for the sake of an accident. Thank you.
Okay.
How much is that?
Okay.
Don't know if you have time to respond.
Yeah, I do. In terms of Amfumu, what we do is that the DHO will split it into zones. So when we are actually taking on that, we'll capture the details of the Amfumu. So every time the does the late, we've got his mobile number.
Okay.
Number two, take on. It will be very simple. Person comes in with his existing passport. When we register him, we'll take the health passport and we will take it on at a later stage, not at that particular point. Maybe in the evening when we've closed, we'll take in all the passports, we'll put them in a spreadsheet and then just press the button and uplift it in the system. The third one is blood group. You remember I said you collect his vitals. When you are checking in a patient at the reception, there are two things they do. They can take on blood, weight, and all that kind of thing. So when now he goes into the clinic, the clinician will see the name of the guy and all his previous history, his blood group, and all his vitals. They will be available.
Thank you so much.
Yeah. And let me just mention further that he can even.
Do you have time?
Okay.
Yeah, time is up.
All right. Okay.
Yeah. But thank you so much for the comprehensive um, responses. We would love indeed that if we had seen the whole prototype, we would appreciate a lot.
Yeah.
But I think there was more time that was spent on the explaining the prototype before it was seen. Yeah. So yeah. Otherwise, we appreciate your time. I think we wish you all the best in the next steps coming. Otherwise, thank you so much for your time. That we will appreciate this new system. We believe that it's going to help a lot. Should this be rolled out? The good thing is that you had visited the DHO, so it means that they also understand
Yeah.
what you are trying to provide. So thank you so much.
Yeah. Maybe from me, if you would allow me, sir, just to mention that I'm very confident that this will work, including the environment. I've been in this business for 40 years plus, so I've been in the IT industry for a long time, and I've seen the failures and sometimes some of these things when they happen, I laugh and I'm not understanding why things are happening in the IT industry now. But so I'm pretty confident this should work, and for the kind of investment we're looking at. Really, if this was a really commercial venture, this is a prototype that would require huge investment. Thank you very much. Thank you. Okay.
Yeah, so we've just seen the demonstration from Mr. Charles, from Mr. Christopher Ganyuka. about a health management system. I think he's putting forward quite interesting proposals. Um, uh, More especially because it's enhancing the data analytics and integration of data from different systems. I think it would be helpful if implemented as he's dreaming. However, the scope is quite substantial. Also, it will have, if he were to realize the proposal, it will have to collaborate with existing systems and involvement of other stakeholders, especially at the his client and the interesting parties that he has already interfaced with his potential clients, which is very critical for the system development that he's proposing. So the panel actually advised him on how best to improve on his proposal, and we wish him well in the next steps. Thank you.
Congratulations for making it to the regionals, and that is for the Muuni Vantage program.
Thank you.
Please introduce yourself. What's your name?
My name is Lisa Dua.
Lisa.
Yeah, my name is Lisa.
How did you find out, first off, that Muuni had this initiative going for innovators?
I came across the post on LinkedIn as I was scrolling through LinkedIn, and it seemed like a good initiative. So I decided to go forward with it and apply, try my luck. And
Yeah. And when you heard that you actually made it?
Well, there was a lot of disbelief. Like, it took several days to take it in, but then here we are. It's real. So
yes.
I'm excited.
What do you do?
I'm currently a student in my second year at University of Malawi.
Okay. Now, Lisa, when you saw it on LinkedIn, I'm sure there was different issues and challenges that were brought to the table. What were you drawn to?
I was mostly drawn to the agriculture sector because I feel like it's a very diverse sector, but then it does not have the recognition it deserves. It needs more efforts into the agriculture sector. So I decided to go for the agriculture sector for my innovation.
Okay. Do you have any experience in that sector? Kulima, at least, please tell me you carried a castle in your life.
No, firsthand. Watch, yes, fine. You've seen things happen. You observe.
Yes.
Yes.
Well, we don't always have to be in there to know what's going on, I guess. So this is you coming in, of course, now with a different level of help in terms of the innovation that you're bringing. What is the challenge that was presented for Nsanje District Council, and what's your solution?
Okay, the problem that was presented was the lack of market information flow for farmers. And we developed the Nkokwe system, which is basically a digital platform for farmers to be able to communicate directly, to record their activities, more like in a very advanced manner, you know?
Ah, okay. So we're bringing agriculture and the digital space
into
together.
the same space, yes.
I love it. I love the name Nkokwe. Who came up with that?
I came up with it.
Look at you. Ah, okay. I wish you well as you go in there, Miss Dua. Go and shine.
Thank you.
Good luck.
Thank you. Okay. So my project is the Nkokwe agriculture system, which is basically a system that has been developed to revolutionize agriculture and bring agriculture to a digital era in the upcoming world. It is a project that is mainly emphasizing transparency and inclusivity of farmers. My main intervention area was the lack of access to timely and accurate market information that leads to low productivity and poor sales. I believe that farmers have poor access to market information, and this in turn affects their productivity. At the same time, the other problem was the traditional entry of records, which has proven cumbersome and has a high possibility of misplacement of records, because currently people would rather write their records and The third problem was that without access to market prices, farmers struggle to make informed decisions about crop production, pricing, and selling strategies. And farmers often face exploitation by middlemen, which leads to low pricing on their produce. The solutions that Nkokwe system is coming up with, proposed solutions for the Nkokwe system is a modern entry system, which all farm records are kept and easily recovered through the Nkokwe system. Farmers will be able to electronically enter their financial records and their crop records, which is easier to keep and record. The other solution is the real-time pricing information. Farmers will be provided with current market prices on the mobile app, website, and the basic access ways. The third solution is the connection to local and regional markets. The Nkokwe system offers direct sales to local markets, cutting out middlemen costs, which usually farmers get exploitation in this case. The fourth solution was the market access information. Farmers will be able to showcase and find buyers for their produce on our websites and systems. Our system has several innovative features and its design. And the first one is the multi-platform compatibility. As you can see, the Nkokwe system is designed to be compatible across multiple platforms, including web and mobile application. Other platforms it will be accessible on is the USSD, which is fully known as Unstructured Supplementary Service Data, and SMS, which is the short message service. In this case, our application is inclusive because other farmers have basic cell phones. So the use of SMS and USSD will allow them to have access to this platform. Therefore, it is available both online and offline. As most are limited to web or mobile applications, the Nkokwe systems ensures all-around accessibility all through mobile and web application, USSD, and SMS, taking in several technological differences. The other feature is the integration with external systems. The APIs, which are the application program interface, and data will be utilized to facilitate seamless integration with government databases, weather services, market platforms, and other relevant systems. Farmers will be able to get information about the weather, compatibility, and what they need to do using our system. The other innovative feature of the Nkokwe systems is the language localization. The system is designed to share information both in English and Chichewa to ensure inclusivity and accessibility for users from even farmers with a poor education background. Provide information and services in local languages, as most of these factors are overlooked. Linguistic diversity is a factor that is overlooked in most cases, especially in regions with diverse language preference. The Nkokwe system will empower farmers with knowledge, and not only that, but it will enhance market access and profitability. It will promote inclusivity and accessibility and drive economic development and food security. Because as farmers have more access to information, they will make better choices, and therefore their yields will be more higher using our system. Our main target markets are small-scale and large-scale farmers which are seeking to improve agricultural practices to increase their crop yields. We are also targeting local agricultural cooperatives who are interested in forming market linkages to enhance productivity and profitability, and agricultural business owners who are looking to invest in sustainable agricultural practices. Value chain actors are also part of our target market, which include wholesalers, retailers, and farmers, with intent to improve efficiency in identification and distribution of yields in markets. We understand that agriculture extension services are a competition that offer a wide range of services, but face challenges of outdated approaches, mismatching of information, and may struggle to adapt quickly to changing farmers' needs and market dynamics. Usually, Agriculture companies have strong marketing capabilities but focus on profit generation, in turn neglect smallholder farmers. The Nkogwe system offers a holistic approach as it offers integrated solutions to address multiple needs of these smallholder farmers. And local expertise in a Malawian context tailor its interventions to specific challenges and opportunities faced by rural communities. And it also enables a more involved process for farmers to make best decisions and gain access to the best technology to ensure maximum productivity and functionality. As of current, our proposed budget was 20.5 million, which includes the development and maintenance costs, operational costs, which cover rent, salaries for team members, marketing and promotions, and monitoring and evaluation costs. And Nkogwe Systems is a self-sustaining program, as it will be able to generate profit from individual subscriptions who are offering the premium features and the basic features. So premium features will go at a rate of 700 monthly. In this case, our targeted market, for example, would be 10,000. In this case, it is a self-generating system. We will also be able to gain revenue from commission from partnership, transaction fees, and advertisement for these farmers' produce and services on our systems. In conclusion, agriculture being the leading sector of development in Malawi, it needs more attention and more advancement. The Nkogwe Agriculture Systems aims to revolutionize the agriculture system in Sanje District Council and do more beyond its borders. It offers an inclusive and transparent and manageable platform to track progress in all aspects, all in one place for these farmers, and timely solutions that have proven to cause serious problems and damage in the past, especially with extension workers stemming from delayed visits or mismatching of information. Imagine a farmer in Sanje communicating with a farmer in Karonga, an extension service worker in Karonga. There would be a different approach to it, while our system is going to connect direct farmers and extension services in Sanje to Sanje tailored farmers. With an investment of 20.5 million to change the agriculture sector for the better and modernize it, Nkogwe Systems is the right project to invest in. Thank you.
Thank you. So, are you done?
Yes, I'm done.
Thank you so much. Just on time. Right, thank you so much, Lisa, for bringing forward this new innovation named Nkogwe Agricultural System. The panelists may have some questions that they want to understand more. So I'll start with
Chair, thank you for your presentation. As you already observed, Chair, I think we would have appreciated the interaction of the actual prototype. But the claims that you have sold to us are quite substantial. My only question is if you have interacted with the Sanje District Council, because those are your clients, and if you had a chance to engage them to see what their needs are, and if the system requirements are emanating from, and the problem definition itself are emanating from their descriptions.
Currently, we weren't able to go on site for better development of the project because we're just trying to design it, but in terms of development of the system, that is the main goal, to advance, to get a database from the Nsanje Agricultural Council that side.
Yeah, thank you very much for your Nkogwe system. I'm very impressed using the local name Nkogwe. Yeah, this is the mobile app application. I have a few areas for clarification. One is the ownership of the application. Who's going to own this particular application? Is it the Sanjay District Council? Is it the Ministry of Agriculture or somebody else? When you complete this particular application, who's going to own it?
Let's see. If I said it should, okay, for now it would be in Sanjay District Council project because that is what we're specifically given. So
So Sanjay will be hosting that, managing that particular application.
no, we hope to expand. So for starting, Sanjay District Council is the main priority.
With the system.
Mm.
Right. When you think about the local farmer, apart from the text, are you thinking of using other way of communicating to the farmers?
There'll be a voice, there'll be the ability to use voice recordings on the application. So farmers will still be able to communicate. If they can't type the message or the information, they'll be able to use the voice recording features and get the information back in the same language. So like connecting them to an extension service worker. So they'll use the voice recording and get like a voice recording from the extension service worker in return. Something like that. So you also use voice recordings on the application because we understand that other people may not have the ability to properly express their problems in writing, so voice.
Thank you, analyst. Just I think that's the time. All right, we have 5 minutes. Thank you. Now, Lisa, when you are looking at the subscriptions or the contributions from individual farmers, you're looking at 700 kwacha per month. I'm not sure if you have done an assessment of the economic landscape or there's the economic ability in terms of managing to pay 700 kwacha every month. Secondly, on the weather predictions, you're saying that the system is also going to tackle weather issues. Which system are you using to look at weather predictions?
In the website, when developing the website, we'll visit the Sanjay agricultural offices and get databases of the information. So including soil factors, we'll be able to get information from them. Because I believe the Sanjay Agriculture Council understands their weather much more better than we would on our own. So we'll get database information from them, which will be fed into our system. So farmers will be able to access it on the system.
No. Yeah. Now on the economic landscape.
On the economic landscape, when assessing 700 seemed manageable. 700 kwacha seemed manageable with our targeted number of farmers because in the target figure was 10,000. So for 700 kwacha for a farm. With further assessment, we see, but for now, 700 seemed more reasonable. In cases where farmers will not be able to manage it with further assessment, we'll be able to put it at a price which would be much more manageable for them.
At the moment, do you know have you had access to information on how many farmers are active in Sanji?
No, not yet.
Right. No, thanks so much. Any other questions?
That's okay.
Good.
Okay.
Thanks so much for the innovation.
Thank you.
Next time, should we have an opportunity like this, start with a prototype.
Okay.
Then you'll be backing up the prototype with the notes. because we need the prototype a lot
Okay.
to see how it's going to work. Otherwise, thanks so much for this initiative. We believe that this innovation can help, and it's very possible that it can solve perennial food shortages that we have experienced in Malawi.
Right.
All the best.
Thank you.
We have seen a presentation by Lisa Zua on the agriculture, referred as the corporate system. This particular system is building a platform where the farmers can interact with the extension workers and agricultural officers using Sanjay. This comes on the case of customer or client. This is a good initiative. We understand that with the climate change in our country and the world at large, we are facing a lot of challenges in our agricultural sector, particularly in the local farmers. So it's very important for the local farmers to get the information as easily as possible and also interact with the agricultural officers as quickly as possible so they can get the information and advice for the next action in their agricultural activities. The advantage of this particular innovation is that it can support multiple languages. So the farmers are free to use any language they want to interact with external workers or agricultural officers. In addition to that, there are also different means of communication apart from the text. We can also use audio, which is most common for our local farmers. However, it requires background information about the agricultural systems and also the behavior of farmers, how they communicate locally within the Sanjay district, for example, and to see how feasible the technology benefits in that particular context. We believe that if this particular initiative is implemented to assist our farmers in terms of information sharing, in terms of communication. Thank you very much.
Kodi mukutipo bwanji zama innovation amene takuonetsani lero? Tuzeni maganizo anu m'makomenti m'musimu. Tuona nanso mawa.
Muuni Fund is here. Yafika. Muuni Fund is here. Yafika. Kuthandiza Malawi tipeze njira zotana ndi mavuto kuza dziko lathu. Muuni Fund is here. Yafika. Muuni Fund is here. Yafika. Kuthandiza Malawi tipeze njira zotana ndi mavuto omwe amagwa mdziko lathu.